Poor and deteriorating. These were the words used to describe the nutritional status of the Nigerian child at the National Summit on Nutrition holding in Abuja, the Federal Capital Territory. Hunger, micronutrient deficiencies and overconsumption have also been identified as some of the nutritional problems in Nigeria. Well, our health correspondent, Yomi Otaigbe, who is attending the summit, now reports.
Faces of malnourished and underweight children, the unpleasant picture of the burden of severe and acute malnutrition in Nigeria, the reason for this inaugural National Summit on Nutrition. The statistics are mind-boggling. Over 40% of children are stunted, and underweight prevalence in the country remains high at 20%, especially in northern Nigeria.
The underlying reasons for those are not really far-fetched. There are parts of the issue that have to do with the population dynamics that I mentioned, part of it with the overall macro, how the economy is doing, the labor market, which entitles some of these children that we're talking about to actually the food that they eat.
We're in a country that we celebrate birthdays, we celebrate 100 days in office, but yet we cannot celebrate the 1,000 days of a birth in Nigeria. Because if we have taken time to look at our children between conception and when they are 2 years old and see the quantum of them that are not likely going to make their 5th birthday, then we will have a sober thinking and a sober reflection.
The multitude of stakeholders from the public, private, traditional institutions and other development partners agree that malnutrition is a major driver of under-5 mortality and must be urgently addressed.
There must be adequacy of food available at prices that people can afford. That's very important. If there's no food, population will be malnourished.
Government by itself will not be able to solve this problem. Not only this problem, but many of the multitude of problems that we have in our health sector. So the partnership of the scaling of nutrition in Nigeria that is exemplified here is key to attainment of not only the nutritional goals, but also the overall health goals that we have in our country.
Effective implementation of evidence-based interventions in tackling malnutrition in Nigeria required a renewed effort at all levels of government, with emphasis on coordinating priorities and efficient utilization of resources. From the National Summit on Nutrition here in Abuja, Yomi Otaigbe reporting for Channels Television News.